Obstetrician and Gynecologist from Atreum Speciality Hospital. I am going to talk about few facts about breast cancer screening. What is breast cancer? Breast cancer is development of the cancer in breast tissues, either in the ductal tissues or in the lobal tissues. Breast cancer is one of the easily accessible organ where the cancer can be diagnosed early so that it can be treated with easy, and the lifespan of the person can be prolonged with less morbidity. What are the symptoms of breast cancer? Generally, a woman will complain of a lump of varying sizes. It may be very small lump or it may be large lump with changes in the skin with or without associated pain, and there may be discharge from the nipple. Some women also come with complaints of lump in their axilla, which may be associated with the lump or it may be an individual lump in the axilla, that is their armpit. These are the symptoms of the breast cancer. Once any women have these symptoms, they'll try to approach the doctor, where the doctor will do appropriate investigations and treat them according to the stage of the disease or the grading of the disease. But what we are concerned today is about the screening, that is the diagnosis before they develop the symptoms, that is at the stage of the signs, how we can diagnose the breast cancer in an early stages. That is the topic of today. See, every woman is at a risk of developing breast cancer, that is 20 to 25% women have developed 20 to 25% of the women have chances of developing breast cancer in their lifetime. The risk may be high if they have associated risk factors, which I am going to explain in some times. Once you know the risk of developing breast cancer, what are the screening tests which we can do it? First is the examination of the breast. The examination of the breast can be clinical breast examination, that is examination of the breast by an expert in that field, that is by a doctor or a trained doctor or a nurse, or self breast examination at the home, which can be done on a routine basis or weekly as it is feasible by the patient. These two also will be helpful in diagnosing the lumps at an early stages if there is any lump. The next one is the radiological or ultrasound based screening test, that is called mammogram, which can be X-ray mammogram or sonomammogram. In X-ray mammogram, we use the X-rays to find the cancers, to diagnose the lumps in the breast. X-ray mammogram is more helpful for a woman who are in the older age and the breast tissue is less, where the penetration of the X-ray is easy. And sonomammogram we prefer in a young adults, where the breast tissue is more and penetration of the ultrasound rays is easier, and it will not give the false positive reports or false negative reports. What are the advantages of ultrasound mammogram over the X-ray mammogram? Ultrasound mammogram is, that is US mammogram is less painful than the X-ray mammogram. Other one is in younger patients, your ultrasound mammogram is preferred over the X-ray mammogram because of its better penetration. What are the disadvantages of the X-ray mammogram is that in a young adult, where if the breast tissues are heavy, the penetration of the X-ray beam may be incomplete and we might have false negative reports, and also it is very painful procedure. Okay, then who all should undergo these tests and what is the guidelines which is given? Generally, we will tell breast self-examination is for everybody and there is no age where you should start doing the breast self-examination. Anybody at any age can start doing the breast self-examination, but there are certain guidelines from RCOG or ACOG or Indian Cancer Institute to screen the women. Women who are at a risk of high risk of breast cancers, high risk for breast cancer, there the cancer screening is advised as early as 35 to 40 years, and annual breast screening every yearly till the age of 49 years. From 49 to 72 or 50 to 72, 73 years, there are two by yearly, that is twice every alternate year they can undergo the screening tests. This screening tests also again depends on the background risk factors. Some people, the doctor themselves advise to undergo a annual breast screenings. What are the what is the advantage? By now you will know of the breast screening, that is you can diagnose the cancer before any symptoms arises, so that treatment can be done early and longevity of the patient can be increased, and with less morbidity because of the associated radiotherapy or chemotherapy. And what are the disadvantages of these breast screening? Disadvantages of the breast screening, first one is false negative reports. Where there is a mass and the screening tells negative, you might neglect on the lump. Other thing is false positive reports. If the breast screening test says that there is a cancer, then we will unnecessarily subject the patient to further investigations, which will increase the anxiety and emotional pressure among them. Or else, if the diagnosis is done with a cancer, we will do many more tests and we will treat them, which will also increase their which will also have an effect on their general health. With all these things, we should weigh the advantages and the disadvantages of the screening tests. When we think of these are only meager side effects, so we should always go for a benefit, that is the cancer can be diagnosed early and treated. Other thing is disadvantage is exposure to the radiations, which is more common with X-ray mammography. X-ray mammography, the radiation exposure is very minimal, so you need not have to worry about that. Another recent advance in the breast cancer screening is elastography. This is more accurate than our X-ray mammography and sonomammography. Here we can get the best screening results. It is more helpful for the women with bulkier breasts. And other genetic screening tests. To categorize the women into risk factors, we do certain genetic markers, that is BRCA genes and HER2/neu and other gene tests, which are generally done for a woman with strong family history where first degree relatives are affected, like her sister, mother, aunt, and also paternal side if they have prostatic cancer or any gastrointestinal tract tumors. These women, we will subject them to even the genetic tests. If the BRCA1 and 2 comes positive, we screen them more frequently than any other women. Or if they have a exposure to the radiation in the early age before 30 years, those women also needs to be categorized into high risk category, and they also need an annual screening, not like a regular screening from these things. The purpose of this session is to educate the women to undergo a regular screening of the breast, so that we can diagnose the cancer at an early stage. And every woman is at a risk of developing breast cancer, that is 20 to 25%. 20 to 25 women among 100 can develop breast cancer in their lifetime. So we are at a risk, and this can be diagnosed and treated early. We have a good life. So with this, I would recommend every woman to undergo a regular breast screenings, either in either ways, either by the X-ray mammography or by the sonomammography. Next sessions I'm going to talk about the treatment. That is, once the diagnosis of the breast cancer is done, how are you going to stage it, and then what is the treatment modalities. For today, this is the session that is regarding the screening. Thank you.